Alert, possible measles exposure in Sheldon, Sioux Center, and Hull. Asterisk asterisk potential measles exposure alert in Sheldon, Sioux Center, and Hull asterisk asterisk. In a concerning development for residents of Northwest Iowa, there is a possibility that individuals who have recently visited Sheldon, Sioux Center, and Hull may have been exposed to the measles virus. This situation has raised alarms among public health officials, prompting them to issue a warning to the community. State health authorities have reported that the most recent case of measles in Iowa involves an adult from western Iowa. Notably, this individual has not traveled outside the state recently and does not have any known connections to other individuals in Iowa who have contracted the virus. Fortunately, this person was fully vaccinated, which likely means they experienced only mild symptoms and are less likely to transmit the virus to others. However, it is important to note that this individual was deemed contagious last week while visiting various businesses in Sioux Center, Sheldon, and Hull on both Monday and Thursday, potentially exposing others to the virus. To help the community stay informed, here are the specific dates, times, and locations where exposure may have occurred. Asterisk asterisk super high-tech, 317 N Main Avenue, Sioux Center, IA 51250 asterisk asterisk. Monday, July 14, 2025 10 a.m. to 4:30 p.m. Asterisk asterisk super high-tech, 915 Park Street, Sheldon, IA 51201 asterisk asterisk. Monday, July 14, 2025 3:35 p.m. to 8 p.m. Asterisk asterisk super high-tech, 915 Park Street, Sheldon, IA 51201 asterisk asterisk. Thursday, July 17, 2025 9:15 a.m. to 8 p.m. Asterisk asterisk Cases General Store, 612 Division Street, Hull, IA 51239 asterisk asterisk. Thursday, July 17, 2025 8:50 a.m. to 10:55 a.m. Asterisk asterisk Quick Star, 1521 Park Street, Sheldon, IA 51201 asterisk asterisk. Thursday, July 17, 2025 2:25 p.m. to 4:30 p.m. This year alone, the United States has seen over 1,300 confirmed cases of measles, making this the 8th reported case in Iowa for the current year. As the situation develops, it is crucial for the community to remain vigilant and informed about potential health risks. Asterisk asterisk What are your thoughts on the current measles outbreak? Do you believe enough is being done to protect the public? Share your opinions in the comments below. Asterisk asterisk. Linn County urges vaccination amid rising measles cases in Iowa. Linn County is sounding the alarm for its residents to verify their vaccination status as the number of measles cases continues to rise. In Iowa, there have been 8 confirmed instances of measles, with 5 of those cases reported in eastern Iowa. Notably, the 7th case was identified in Linn County, prompting the local public health office to express growing concern over the situation. Heather Meder, the supervisor of the clinical branch at Linn County Public Health, stated, "Currently, we are seeing an average of 40 to 50 measles cases each week across the nation, which is quite alarming." Despite the increasing media coverage surrounding measles, many residents in eastern Iowa remain unaware of the outbreak. In conversations with Iowa's News Now, several individuals expressed surprise at the resurgence of the disease. One person remarked, "I didn't even realize that measles had returned to the United States or Iowa." Another individual mentioned, "I've heard about one case in Cedar Rapids, but I'm not very familiar with the details." A third resident noted, "There hasn't been much discussion about it lately." The confirmed case in Linn County has connections throughout the area, including a daycare that Mark Disbrow's children attend. Disbrow shared his feelings, saying, "It's concerning and can be quite frustrating, especially in a place like a childcare center where we expect our kids to be safe." Meder explained that the county is actively monitoring the virus and conducting contact tracing to manage the outbreak. "We reach out to the individual diagnosed with measles and ask them about their symptoms, when they started, and where they might have been exposed to the virus. We also inquire about their locations during the infectious period," she explained. Once an exposure is identified, the county discusses the individual's vaccination history and the necessary steps to protect the community. "The actions we take depend on when the exposure occurred, but our primary goal is to ensure everyone's safety, Metter emphasized. Unfortunately, if someone cannot provide proof of immunity, we may have to quarantine them for up to 21 days. That's a significant amount of time to be away from work, school, and other activities, and we truly want to avoid putting anyone in that situation. Linn County Public Health is urging residents to take proactive measures. If you are unsure about your vaccination status, don't have a record of your vaccinations at home, or lack proof of immunity through a blood test, now is the time to address that, Metter advised. To assist the community, Linn County is providing free vaccinations. If you experience symptoms such as a high fever, runny nose, cough, red and watery eyes, or a rash, it is crucial to contact your healthcare provider immediately. But here's where it gets controversial. Some people still question the necessity of vaccinations. What do you think? Are vaccines essential for public health, or do you believe individuals should have the right to choose? Share your thoughts in the comments. Measles exposure at daycare, a family's struggle and the importance of vaccination. The recent measles exposure at a daycare center in Iowa has had a profound impact on one family, forcing them to make difficult choices and highlighting the importance of vaccination. Martha Martin, a 26-year-old mother from Cedar Rapids, Iowa, has had to use up all her vacation days for the year to stay home with her 9-month-old son, Hal. And even that isn't enough. Hal, who hasn't received the MMR vaccine yet due to his young age, was exposed to measles at daycare and now faces a 28-day quarantine period, as recommended by the Centers for Disease Control and Prevention. It's scary because my son is not protected, and I'm having to worry about childcare, my job, and my husband's job, Martha shared. Her husband will have to take unpaid leave to care for Hal once Martha returns to work. This situation is not unique to the Martin family. As measles cases surge across the nation, surpassing levels not seen since the virus was declared eliminated in the US in 2000, many families are facing similar challenges. On Wednesday, the CDC reported 1,309 cases in 39 states, with the majority of patients being children. A lot of our families, hardworking families, typically don't have a month's savings of salary to stay home, yet they have to, said Dr. Ana Montanez, a pediatrician who treated families during the recent measles outbreak in West Texas. Cedar Rapids itself isn't experiencing an outbreak, with only 7 cases confirmed across Iowa in 2025. But the Martin family's situation serves as a stark reminder of the potential consequences of a single exposure. What's happening in our town is a perfect example of why vaccination is important, said Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health Cedar Rapids. It just takes one measles case to cause a ripple effect, he emphasized. On Saturday, Dr. Arnold oversaw a command center where immunoglobulin, IG, injections were administered to 8 babies, including Hal, who had been exposed to measles at the same daycare. 3 other infants received the treatment at a nearby medical facility. IG injections, which can be given up to 6 days after exposure, have been found to be highly effective in protecting exposed newborns from the disease. While IG treatments provide temporary protection, vaccination offers a much higher level of immunity, according to Dr. Tina Tan, president of the Infectious Diseases Society of America. The Cedar Rapids IG clinics were organized at the last minute, with families notified late on Friday, July 11th, about the exposure that occurred the previous Monday. There are infants out there who have no protection, and we don't want them to get sick, Dr. Arnold said. Measles can be mild, but it can also be life-threatening. Although the majority of measles patients have recovered well, 13% required hospitalization due to the infection. Sadly, 3 people, including 2 young girls in Texas, have lost their lives to measles this year, with another child in England succumbing to their virus just last week. This story serves as a powerful reminder of the importance of vaccination and the potential consequences of a single exposure. It highlights the challenges faced by families and the critical role healthcare professionals play in protecting vulnerable infants. Are there any specific aspects of this situation that you'd like to discuss further? Feel free to share your thoughts and experiences in the comments below.